It is a pleasure to see everyone gather for the pursuit of knowledge, especially when it comes to enhancing our country's acceleration through the adoption of digital methods. Before that, we would like to bless this morning's event with the recital of Surah Al-Fatihah.
Astaghfirullahaladzim allazi la ilaha illa huwal hayyul qayyum. Al-Fatihah. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Arrahmanirrahim. Maliki yaumiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim. Siratal ladzina an'amta 'alaihim ghairil maghdubi 'alaihim waladdallin. Amin.
Amin, amin, ya Rabbal Alamin. Next, I would like to invite Yang Mulia Muhammad Nurulham bin Haji Zaini from AITI to give their welcoming remarks.
Okay. Thank you, Hani. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to you all. It's a great pleasure for the Authority for Info Communication Technology Industry of Brunei Darussalam, AITI, to welcome you to this webinar. Ladies and gentlemen, DigiBiz Talk is one of the initiatives by AITI to encourage ICT and digital adoption in the country, particularly to support the growth of the businesses through a series of seminars related to emerging technologies. Today's seminars focus on health industry and aims to promote the adoption of technology as well as share its use cases. 5G is the fifth generation mobile network designed to connect virtually everyone and everything together, including machines, objects, and also devices. It's meant to deliver higher multi-speed data speed, ultra-low latency, more reliability, massive network capacity, increased availability, and a more uniform user experience. One of the use cases on using 5G networks in health industry is telemedicine. Telemedicine refers to the provision of remote clinical services via real-time two-way communication between the patient and the healthcare provider. In addition, its readily availability of patient records online has the potential to make patient prescription more reliable and accurate. Ladies and gentlemen, to have a better understanding on the topic above, we have invited moderator and regional experts to speak more on this. Before I end, I would like to thank Recap for facilitating. I wish everyone an enjoyable and a very informative session. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Thank you.
Waalaikumsalam. Thank you, Yang Mulia Muhammad Nurulham, for your speech. Finally, I would like to extend a very warm welcome to our esteemed speakers. We have Audrey Maximillian Herli from Indonesia, along with G. Saravanan and Rajeshwari Kanesin from Malaysia. So Maxi will be opening with a speech on what's new with healthcare, with a touch on mental health. He's the star founder of RiIliv, where he entered Forbes 30 under 30 in Asia under healthcare and science back in 2020. He believes in changing and improving people's lives with information technology, and through RiIliv, he aims to address the social stigma of being diagnosed with mental illness, along to improve mental health treatment in Indonesia. Our two speakers, Mr. G, I'll start with him first because that would be his first session. He is a seasoned Chief Information Officer and currently spearheading Thomson Group Information Technology Division, but he's worked throughout Southeast Asia and the Middle East as both a client and consultant. He is well versed in healthcare IT, especially when it comes to 5G strategy, and he strives for healthcare IT excellence. Our second speaker, Ms. Rajeshwari, has over 15 years in tech, where she holds expertise in research, product development, consulting, and management. Currently, she is the enterprise strategy healthcare lead of Digital Nasional Berhad, where they are determined to lead the transformation of the healthcare industry by focusing on digital health and medtech innovations. Our own Florence Yapp will be easing us into the webinar today as a moderator later during the Q&A session. Florence is a Senior Executive Customer Success at EVYD Technology, working with governments and healthcare providers to leverage AI and big data to optimize healthcare systems and provide better care to the population. She believes in empowering the community and patients with digital tools and looks forward to a future where healthcare is accessible to all. Now, without further ado, we shall start with the webinar. The floor is yours, Maxi.
Thank you so much for the opportunity. My name is Maxi. I'm a co-founder of a mental health startup from Indonesia. We started from the problem there are more than 20 million people who have mental health problems, and there is a prevalence 1 in 5 people in Indonesia have a well-being problems prevalence. And from these phenomenon and these problems, we started RiIliv. So it's a one-stop mental health service. People can talk with a professional psychologist and have a content like meditation and mindfulness content. And I think 5G technology has the potential to revolutionize the mental health services are delivered and accessed in Indonesia. With its high speed and low latency, mental health professionals can provide a real-time support for patients, for online counselings, allowing for quicker diagnosis, treatment plans, and support. And additionally, 5G technology can increase accessibility for those living in remote area and or underserved areas in Indonesia where the access mental health service may be limited. And also 5G can provide a cost-effective solution for people who may have a difficulty traveling to a physical location for therapy sessions. And this can greatly benefit the people in Indonesia who often face challenge in access mental health service. But the potential for 5G technology in the mental health fields extends beyond just online counseling. The technology can also enable the use of VR and AR, virtual and augmented reality, which can provide the new and innovative ways for patients or clients to engage in therapy. So this can be particularly useful for those who may be shy or uncomfortable discussing their mental health issues face-to-face. And with the rise of the metaverse, we may even see the virtual reality environments specifically designed for mental health therapy. So these environments could provide immersive and interactive experience that can help patients overcome their challenge and improve the mental health well-being in Indonesia or even in Southeast Asia. So in conclusion, 5G technology has the potential access to greatly improve access the quality of mental health service in Indonesia, from real-time online counseling to immersive virtual reality environments. The possibilities are endless. So let us embrace this technology and use it to address the growing mental health problem in Indonesia and provide the support the people in it. So thank you very much.
Thank you, Maxi. I really do appreciate what you are striving to do here. I think it's really important, especially for Brunei, to also take this into consideration. So thank you again for sharing your slides, Maxi.
Sure, you're welcome.
We'll be hearing Mr. G's side now on his expertise in 5G.
I think 5G is such a buzzword, and everybody just goes on into the 5G bandwagon without knowing what is it, how is it useful, and most importantly, why 5G. So I'll try to cover those basics in my slides. I hope I'm clear enough for everyone. All right, let me know if I'm not. Yeah, I'm not going to read through the whole text. Obviously, everybody knows what is 5G, but what is actually a blur line is 5G is not the same in different geographical zone. Unlike 4G or the predecessor 3G, see 3G when it was rolled out in about 22 years ago, I was a part of the team, and 3G had a very well-defined number. If I'm not mistaken, it's 384 kbps. And as soon as any technology, any mobile network technology reaches that speed, it will be categorized as 3G speed. Unlike that, 5G is totally different because there's no specific speed limit or saying that this is the minimum. So many permutation with regards to frequency, bandwidth. Say that 5G represents a major step forward from the 4G network, right? And it is meant to go into gigabytes of data bandwidth per second. Okay, so as long as a network reaches gigabit, it will be known as a 5G network, mobile network. Okay, that is a very, very broad definition of 5G. Right. Now, there's another perspective here. And I get this question from the public whenever I give speech, or especially from my close friends who are very skeptical about why we have to invest so much. Not just at the enterprise level or company level or even ministry level, the whole country. Because every time there is a jump from 3G to 4G and 4G to 5G, it requires billions in terms of investment, literally billions, right, from the license to the upgrade of the network. And in the case of 5G, it's almost a total revamp of the 4G network. So the question is, do we need 5G in the first place? And if yes, why? Because the common question is, I'm sure by now everybody knows the use cases in telemedicine. We're talking about remote monitoring, sending your blood pressure data, sending your glucose data, sending your weighing scale data. And while you are running, sending, let's say, data from a smartwatch like the Samsung watch or the Apples of the world or Xiaomi of the world and so on. So to send such a data, do you require 5G? The answer is no, you don't. All right, this may sound surprising to many people, but 4G is actually good enough for you to send many of the parameterized data, which is very text, it's a text data, and which is very, very small data. But if that's the case, why 5G then? Now, in case you're wondering why my slide is empty, because usually when I talk, whether I give a lecture or talk, I like to give it interactional, both ways, like a Q&A. But obviously right now, I don't expect you guys to ask me questions yet. So here's the thing, guys. So 5G is one of the primary criteria on why 5G is a game changer when it comes to connected devices, be it healthcare devices, be it your IoT devices for, manufacturing, warehouse. It can be your water tank or the water supplying. It can be your oil and gas pipelines. The major difference is 5G network is meant to support up to 1 million devices per square kilometer. Just try imagining, guys. I'm sure you know that how big is a kilometer, right? So just imagine 1 million devices, right? And this goes in line with our vision, or when I say our vision, I'm talking about the world vision, that every single device which is used by human will be connected, will be an IoT device. This is not just your watch, it's not just your laptop, it's not just your car. I'm also talking about the shirt which you wear, the pen which you carry, the wallet which you carry, as well as all the other healthcare devices. So if you go to your home right now, I'm sure whether it's yours or parents or grandparents, you can find your blood pressure meter, your glucose meter, your weighing scale, your watch. So every single devices there has to be 5G connected, should be 5G connectable, right? But can you imagine doing the same thing using 4G? I'm sure by now you're wondering what are the limitations of 4G. Now, when it comes to 4G, 4G only supports maximum 60,000 devices, 60,000 connection per square kilometer. Can you see the vast difference between a 5G and a 4G? And of course, there's a number of other things like latency, speed, reliability of connection, and so on. But even before going to all of that, many a time institutions and governments do not realize that the vast difference between 4G and 5G is not so much on the connection and the speed and latency only. It's also the number of devices which can be connected. What this means is, if I'm the government of Brunei, or if I'm the government of Singapore or Malaysia, right? If I'm rolling out a particular program for the public, for the citizens of my country, if I go to a highly dense population, right, and if I'm only using 4G, besides the fact that I've got limitation in terms of speed. Now, again, let me repeat, when it comes to sending text data, like from this kind of a watch, IoT watch, I can put a SIM card inside and I'm sending data. Connection speed actually doesn't make much of a difference. Even latency doesn't make much of a difference. Latency makes a difference when I'm watching Netflix, HD, for example. Then it makes a difference, right? So 4G is good enough, but it makes a difference if I'm rolling out national program to my population for population health. Then 5G makes a difference. Okay, so that's all the point for this particular slide. It's very important for us to know why, right? Okay. Next. So fine. So we understand what is 5G more or less, and then we understand that why we need 5G and why 4G alone will not be sufficient. All right. Next, we need to understand, what does 5G bring to the table? What can 5G do for us, right? And before I go to the details in terms of various use cases, like what Max just mentioned for mental health care, and I guess he mentioned about metaverse and so on. So those are some of the use cases. But in a broad level, for healthcare per se, what does 5G bring to the table? And this is something, it's not official, but it's something which we envision, those who are on the healthcare line, that 5G will be able to deliver 60% of the inpatient services at your home. Now, just imagine, for those of you who have children, or you have siblings, or you have seen your family members, during the COVID-19, many students, if not all students, did not go to school. What happened then? The school was brought to your home. Am I right? And for some, this went on for years. In fact, I think some of them are still there at home, actually. So in similar concept, how the internet managed to bring the school to your home, imagine the same concept, that the future of hospital is not in the hospital. In fact, it is said that the vision of a country, vision of a Ministry of Health of a country, is to make sure the hospital is empty, right? Only then that means patients are healthy. But in our case, the congestion within hospital is just increasing day by day. And I can go on and on about examples in various countries, right? Even developed countries, where the emergency room is so congested, they have stopped allowing patients to walk in. So the vision is that we will change, we will move from hospital to something called the hospital. This may sound like a play of words, but this is the truth. Now, this is not a product. I'm not selling any product. It's purely conceptual at this point of time. We are discussing about it in few governments, including Malaysian government, in terms of how we can lessen the congestion at the hospital and deliver more services at the home of the patient, at the house of the patient. If you take UK, for example, I'm aware in South London, for example, you are no longer allowed to walk into emergency room of the hospital. Even for you to go to the hospital, the triage meaning assessment of the patient, usually triage happens at the hospital. When you enter the emergency room or emergency department, the next time you go there, hopefully not, but if you do go there, you may be exposed to a color coding. There's yellow, green, orange, and red. This color coding indicates how severe is your case and how soon and how fast we have to deliver. The hospital has to deliver services to you. And this triage is meant to be done at the home via phone call. And if your triage is not so high, that means your case is not so severe, instead of you traveling to the hospital will be delivered to your house. And that's the concept behind hospital. And there's also other cases. Now, this is before patients enter the hospital. There's a number of use cases which says that once a patient has received care, has received the procedure, the treatment, or whatever they're supposed to receive, for the monitoring part of it, the patients most of the time are just occupying or using up the bed. I'm not going to say unnecessarily, but the amount of services which can be delivered to the patient at the hospital at that stage is very minimal. All right. For the both government hospital and a private hospital has a problem with this. As far as the government hospital is concerned, that bed is better utilized by another patient who needs severe care, who needs to be treated urgently. That's number one, from government. From a private hospital, it means that they get to clear the bed, put another patient there, and earn money from another patient because they are mostly insured patients. Okay, so in both the scenario, the importance of clearing the bed, sending the patients back home so that patients can be monitored and delivered services to at their home becomes important. Okay, so that's the basic concept behind hospital. Let me move on. The next will just be an example. Okay, now this is an actual newspaper cutting, an article, and this just came out 2 days ago in a hospital in Bristol, UK. And this is actually a realization of the very concept of hospital. Okay, of course they call it hospital at home, right? Government's hospitals at home scheme launches in Bristol with hundreds of patients sent home. I know sent home sounds bad, but here what it means is the bed is cleared for the patients, for other patients to receive the treatment. All right. Now, beyond this, this is the major point which I want to put forward, that with the advent of 5G, this hospital can be realized. Beyond this, I'm just going to go through some use cases some examples on how this is called the 5G tours program. Now, tours does not mean like tourist program. Is actually a program in the Europe where there are multiple vendors, telco vendors like Nokia for the switches, Orange, the telco provider, and there's a hospital in France who are participating. This started off in the fall of 2020. It's still ongoing right now. There's many use cases here I would love to share. It's too much for me to share. To be really honest, half an hour is very short for me to cover a lot of use cases. So I'm just going to glance through and probably can cover more towards the end during the Q&A session. Quickly, just to demonstrate how efficient, reliable service can be delivered using 5G. There's a particular KPI which has been measured. I'm more than happy to share the actual outcome of this program itself with everyone. I've got full access to the program itself. In the overall scenario, some of the technologies which are being deployed is constantly monitoring patients who are chronically ill. They also provide ambulance routing, right, to make sure with regards to traffic and automatic real-time information, regards to patients' information at their home, as well as during the patient within the ambulance while they're being sent to the hospital, so that ER doctors will be able to guide the paramedics within the ambulance, or even when the paramedics arrive at the house to attend to the patients. Okay. Moving on, so these are the more specific. So this talks about continuous monitoring of the chronically ill patients, fairly elderly. This particular use case is also being used in the care homes. I'm sure everyone knows how the care home, I'm not going to say business, industry is huge in the European Union. Even if you take UK as a small country compared to many other European nations, it has world's largest care houses. Okay, so the care homes in the UK are meant to be 5 times larger than the care homes in the US, and they are one of the first to embark on this remote monitoring using 5G, mainly because it is said that more than 50% of the death which happened in COVID-19 in the UK happened in the care home. And this is simply because monitoring was not done. And again, when I say monitoring, right, many of you will be thinking, why can't I just use Wi-Fi monitoring? Why do I need 5G? Now, here is where it's different, where 5G, I'm showing is mobile. So you get to monitor the elderly patients even when they're out there jogging, walking, shopping, and so on, right? So anyway, going back to the use cases, I'm just going to run through, guys. So the advantages: early release from the hospital possible because they're sent home, monitored at home, timely responses because they are always being monitored. There's also other things beyond pure healthcare. They are fall detection, they are movement detection. Let me quickly tell you what it is. Movement detection means like this. Obviously, if a person is within the washroom for 3 hours continuously, something's wrong. If a person is sitting down on a chair for 6 hours, something is wrong. So such movement can also be detected, right? Even in China, for example, during the COVID-19, there were hospitals purely using 5G because hospital has to be networked typically. But during COVID-19, hospital was being erected, set up on the fly. So it's impossible to deploy high cost, highly configurable network in the hospital. So what they end up doing, putting a 5G antenna there and deploying a 5G network, very high bandwidth network on the fly. So there's another use case. I'm just going to go on. So we get to monitor patients, we have dashboarding, we have wearable devices. All of these are connected to the cloud, and all of this will be monitored again while they're at home as well as the outside. I mentioned about this just now. Ambulance means routing. This is to, of course, avoid traffic jam, as well as communicate with the critical patient data while they are on the way to hospital. And diagnosis via television, via video conferencing, diagnostics, as well as radiology equipment. For example, mobile radiology equipment can now be deployed at the house, at the home, at the battlefield, for example, for military usage. So various use cases there. Interventional equipments, as well as this is a very good use cases. Now, typically a surgeon will not be operating alone. He will always be assisted by other consultants. And it is said that the more consultants get involved in a particular surgery or operation, the higher the chances of that operation becoming successful. Guess what? With 5G, you can deliver this outside of the operation theater. You're no longer defined or confined within the limitation of the operation theater room. Right. To summarize, these are the other use cases which is available. Now with 5G, you get to also increase the patient's experience. Now patient experience is important because it is said that within a hospital, you can never eliminate patient waiting time. But what you can do is you can make the patient experience better, right? We mentioned about remote medicine, virtual consulting just now, and of course, remote patient monitoring. With all this, it makes a hospital becoming a connected hospital, more data, and more data means you can deploy more data analytics. And with more data analytics, obviously, the hospital becomes a smart hospital. And of course, the same data can augmented reality and virtual reality medical training. What this means is this. Imagine a consultant, from the first time they start to practice on a real human. That's impossible. They should not be done. So with 5G, what we can do is we can deploy this virtual training platform in a simulated manner instead of a actual patient being operated on. And of course, we have smart ambulance. Let me just move my mouse. For asset management, now, asset management is a huge topic in the healthcare as well when it comes to hospital, because hospital owns usually millions of assets within the hospital. So it's important to track, to monitor where the assets are going and so on, right? AI-assisted healthcare, and of course, finally, the most interesting part is actually robotics platform itself, right? Now, that's all I have for today. If you have any questions, you may have your questions towards the end. That's it from my side. Thank you very much, guys.
All right. Thank you for sharing your slides, Mr. G. I think from your presentation just now, I really can see how 5G lessens the gap to allow more accessibility to healthcare. Thank you for a wonderful peek into how much 5G can contribute to the healthcare scene. I think Ms. Rajeshwari, our second speaker, can add more insight to this. So how about it, Ms. Rajeshwari?
Thank you, everyone, for having us here. And a little bit about me. I'm from Digital Nasional Berhad, which is the single wholesale provider of 5G infrastructure in Malaysia. And I lead the health tech strategy for the enterprise team. Yeah. And today I'm going to be touching a little bit about really what is 5G and what are 5G enabled digital services, and then how are we now looking into accelerating the whole 5G adoption in Malaysia, right? And a little bit of step back again, more details on what is Digital Nasional Berhad. We are actually owned by the Ministry of Finance, and we are the 5G infrastructure provider. So in Malaysia, we are quite unique. We are the only 5G infrastructure provider. So we build the telco networks for the country, right? And of course, this is also part of the other part of it is to actually ensure that the whole ecosystem is also built together with it, right? Hence, to actually realize in every industry how 5G would actually make sense. Now, I think this is something that we've already known, but I'm just still going to be able to share a little bit on this, you know, how we evolved from 1G to 2G to 3G. Oh, why is my, 3G. And I think the previous speaker actually touched a little bit on 3G and what was the limitations that we faced with 3G era, which is right now in Malaysia, we've already sunsetted 3G. So, you know, now we are completely dependent on 4G. The whole gist of this whole thing is that 4G was a consumer world. It was targeted for consumers and we learned how to stream our mobile devices. We learned how to, the YouTube content, a lot more usage for consumers. But 5G now brings the usage for the industries. So we are going to see a lot more transformation across for industry usage rather than consumer usage. So that's the focus that we want 5G to take over. Yep. and a little bit more details into what 5G can do and compared to what 4G didn't, compared to 4G itself. So there's a lot of technical terms here: latency, throughput, connections, and I think G actually brought it out again regarding the whole connectivity, the massive amount of devices that can be connected through 5G. But it also is a very clear, and based on the use cases that you do for healthcare, and especially when healthcare statistics are actually very critical. Imagine being in an ambulance and all of that, right? And having a video conferencing with your doctor in the hospital. The paramedic should have a very, a stable connector, a reliable connectivity. So that's very important, that to ensure that we are looking at latency plays a very important role. And of course, the throughput, which is the speed that we're talking about, that makes a lot more difference, especially your download and upload speed. So that with 5G, we can actually get to a very high speed, 100 times better than 4G, right? So that's the kind of, statistics that we're looking at, getting an uplift from 4G. And a little bit more to the other two factors, the mobility and the architecture wise, right? Mobility in this word is actually when you are traveling in a high-speed train or whatnot, you do not want to have a drop-off of a network. So that's what 5G brings. You are able to travel in a high-speed environment and also have a stable connectivity in a 5G environment, of course. And the architecture of 5G is quite special because the architecture now has the capability to have a slicing over the 5G architecture, which means you can have a dedicated application running for the particular on 5G only. So for example, that means now you're running on using your Teams or Zoom, and imagine that the speed or the bandwidth that you're consuming for 5G, for your Zoom application is dedicated. That means it's not shared across the other applications that's running on your other software applications that's running on your laptop. So imagine having a separate slice only for that particular application. That's how the architecture is 5G architecture can cater to do this. So that's the kind of innovative designs that we're looking into when it comes to applying 5G into industries. And if you look into this right-hand side where the whole services, right? So it was actually very right. There are actually 5G comes with three different services, which is the enhanced mobile broadband, the massive machine type communication, and the last one, the ultra reliable low latency communication. There are three services that that 5G enables, right? And now we are not only talking about healthcare, but we are also looking as 5G as a catalyst for industry. Like I mentioned, 5G is more of a game changer for industry applications rather than consumer applications, right? So for Malaysia, we are actually seeing, a 3.2% increase in sector GDP across healthcare. And we'll now look into, wow, what are the difference that we're going to see and all of that, right? Okay, so before I get into the whole topic of 5G, what 5G can do and whatnot, but it's very, very important for us to understand what is 5G digital services. 5G alone will not make a difference. As the connectivity alone will not make a difference. The whole value chain has to be also transformed. So, and 5G has to work together with the value chain. So, we are looking at massive amount of devices that are going to come up. You're going to have to need the 5G connectivity, of course. You're going to see that platform, the need for edge compute. You will see this word coming up again and again soon as you talk about 5G, because edge compute allows computing close to you, enabling you to actually do all of these computes that need to be done by the sensors or whatever data that's collected within your devices. And then you can have faster compute speed through this edge compute services. So these are the kind of components that are very important in order to make sure and a whole value or a whole digital services actually comes to the market. So we are talking about applications here. We're talking about, devices, applications, and with connectivity, 5G connectivity, that will actually make the difference. So 5G alone, again, 5G alone will not make a difference. That whole value chain needs to be also uplifted together right now. So what else is 5G going to do? So 5G is going to work together with a lot of other emerging technologies like artificial intelligence, big data, cloud computing, data centers, and all the edge compute as well. So these are the few, it is buzzwords, yeah, but you would see this in terms of, applications that you are going to see coming up in the future, right? That to incorporate all of this within the application, then the need for 5G will actually be valued, right? I'm going to get into the step into about the healthcare part of it. So looking into healthcare globally as well, the expenditure has been increased, especially after COVID as well. And if you could see, the increasing cost of healthcare globally in US, Europe has also been increased over the last 30 years or so. And you see that aging population and NCDs are also increasing, which is quite bad. But then again, the whole healthcare expenditure is now more shifting towards prevention and well-being, right? So that means people do not want to be only cured once they are sick. So the whole healthcare expenditure is now focused on prevention, awareness, and all that. That needs to be also focused. And there's a lot of focus globally as well. They're moving towards that, right? Now, a little bit of developments, insights on what's actually happening in Malaysia and how are we doing on this area. So in terms of healthcare digitalization, Malaysia is striving, I would say, to actually address this whole challenge as well. Based on the strategic framework of medical program in 2021 that was launched by the Ministry of Health, it was actually important to note that there were 3 key areas, and which we hope 5G could also be an enabler to solve it, right? One is that sustaining the national health indicators. So we are on a decline in terms of the health indicators. That means we are a country that is facing a lot of health issues. And number 2, the insufficient human resource with increasing workload and complexity. There's a lot more doctors, less doctors in Malaysia that to support the healthcare system. And number 3, the rapid development of technology, healthcare, and research that's needed for us to actually be a benchmark of a hospital as well, right? So these are the 3 key importance that we see that we need to, strengthen the healthcare system, right? Now, what has happened after COVID, right? Malaysian hospitals were overstretched as well. I mean, I guess it's globally, right? Even in any country, there's been a big impact after COVID. Now, the whole thing happened with the shift towards enabling immediately the whole remote video consultations, patient monitoring, and also creating the need for a digital healthcare platform. That has started a little bit. That moved towards to start and kickstart that initiatives, right? Now, and then there was a whole emergence and growth of the health tech industry in Malaysia as well. So a lot more health tech startups, you can see a lot more health tech startups, a lot more on the non-clinical side, but there has to be a lot increase. They launched a health tech sandbox program to actually incubate all of these health technology companies. And these are very, very important for a country to actually start incubating their own startups in that area, especially for healthcare as well, right? So, and based on the framework earlier that I was talking about by healthcare, by the Ministry of Health itself, we look down to what are the challenges that are actually the healthcare industry is facing today, the common pain points the healthcare industry is facing. These are the top 8. The list can be very, very long, but if you look at the top 8, and these, if you actually look into what are the digital solutions that are also coming up, they're very relevant. If you look at into number 1 being the increasing number of non-communicable diseases, then you would need a lot more continuous patient monitoring. And these are 5G related solutions that could actually ease And you will see a lot more devices that are coming up. I think G spoke about this in detail, so I would just go on to the next one. The second challenge that they are facing is, of course, the maintaining the quality of healthcare service, the hospital congestion, the waiting time. It is quite a hassle to actually go to the hospital today, right? And of course, that whole, I think the whole concept of hospital is coming in, the whole remote consultations that is coming in terms of discharging the patients earlier to actually, reduce the hospital congestion and then monitor them from home. These are the kind of solution, 5G enabled solution 5G could enable, and also number 3, this is a very important one. I'll give you a more in-depth example of how the rapid development of technology, right, in healthcare industry. So the whole idea of, ability that even for teleradiology, that you're going to see a lot more innovative ideas in terms of radiology units, in terms of imaging, how today scanning, like your x-rays and CT scans are limited into a 2D image, and how we can embark on a 3D imaging. How does augmented reality come into picture for this as well? And 4, 5, and 6, and 7, I think, a lot of these challenges are quite common to a country, especially for in a healthcare sector. So if you look at managing a disaster in terms of how you need, connected ambulances, how you can actually utilize drones for this, and the whole continuous learning for doctors that is quite needed. These are the quite key important challenges that needs to be addressed. And when you talk about healthcare industry alone, we are not only specifying that this has to be only for hospitals. We are also going to be looking at how 5G would be a difference towards clinics, the networks of clinics implemented, the emergency services, which in sometimes are private sector. For example, in Malaysia, the private hospitals are actually outsourcing their ambulance services. And then custodial care deliveries, long-term care deliveries, all, these are very important as well. And medical training universities and hospitals. And of course, the last is the hospital facility and asset management. These are the core focus in terms of who we should transform and how we should transform. And when we talk about transformation, it's very correlated to the challenge, the digital solutions that we're talking about, how these are going to be transformed in these particular areas, whether it's a hospital or not. What are the 5G relevant solutions, and how can 5G be deployed in these areas, right? So, okay, I'm going to take a little bit of a topic on how are Malaysia doing this. How are we trying to accelerate the adoption? We talked about 5G enabled digital services earlier, and how important was it, as a value chain, it's important. Now, how are we trying to accelerate the adoption of the whole 5G enabled digital services? So there is a long-term initiative that we take in terms of creating a whole healthcare data platform. And also in terms of a short-term and mid-short-term, we also look out for solution providers. And we look into what are the solutions that need strong connectivity. We want to enhance the solutions with 5G. How can 5G help in their solutions and building right solutions as well? So these are the kind of, few of the solution providers that we work together with. And of course, we are open to working a lot more with, the market is huge, and we're open to bring in a lot more global players and Asian players, startups in this space to come to Malaysia and penetrate the market. And what we do together is that we allow them to do proof of concepts in public and private hospitals. So that's the kind of accelerator programs that we run together with them. Now, I think I'm going to just give a very short brief about, the connected ambulance story. So now giving you a little bit of example how we look into this whole, we look into the whole pain point and the 5G digital enabled services, and how all of these coming into picture. So if you look at it from the top part of it, right? Well, I explained again the devices that needs to be connected. The connectivity, we are quite agnostic. if it can work in 4G, you should be able to use 4G. And when you need 5G, then you should move into a 5G environment. So not all devices would need 5G, but when you look into, for example, when you look into ambulance services, especially when the paramedics need to connect back to the hospital and to talk to the doctors, to do the whole tele-consult while moving in an ambulance services, then that whole reliability of connectivity, then that particular solution alone can also be transformed into a 5G solution. And the rest of the devices can also still be on a 4G or a Bluetooth environment in most cases. Some of the monitoring devices are Bluetooth enabled. So that is fine, but the whole importance needs to be given to how they actually use 5G as for the important devices alone, right? And basically 5G also complements the whole, the whole value chain, right? You do not, the whole network transport does not need to be solely dependent on 5G, but you could actually be a complementary, right? And a lot more, cloud, even if there is a need for an edge compute, there's a need for immediate processing, then you need to enable an edge compute service. If not, you could just use a cloud services, private or public cloud, and you need the application layer as well. So if you look into that, that's the whole value chain that we're talking about in terms of connected ambulance, right? And when it comes to a scenario, the 5G connected ambulance, they are equipped with devices that are actually providing real-time information back to the hospital. So you would see that the whole hospital has actually been changed today to actually be monitoring all of these. Not only they're monitoring where the ambulances are, but they'll have to also monitor who are the patients that have been carried on, and to be prepared way ahead before reaching the hospital. So one of the key important things is that how crucial it is for a patient to reach the hospital and the hospital be prepared with, the whole triage process and all of that. So that's very important. So the overall benefit, of course, is it potentially saves time, the response time, the efficiency, and saves more lives. And that's one of the key benefit that we see. And we see this, being done there's a lot more solutions that are coming up in this whole thing with 5G as well. And I'll give a second example in terms of the mixed reality and the extended reality, augmented reality, virtual reality world as well. Yeah. So in terms of, imaging, right? In terms of, looking into X-rays and like I explained earlier, X-rays and CT scans and MRI scans, doctors have always been used to seeing these images and trying to visualize them on their own in a 3D format. I mean, they have to imagine on their head, right? On their brains. But this whole mixed reality solutions actually transform that, enables the doctors to actually wear the smart glasses. For example, in this case, we're actually using HoloLens for this, to look into the HoloLens and to be able to see that scan in a 3D holographic image. So this is a great example. We are testing this. It's already been applied in Singapore today. And we are actually proof of concepting this in a couple of hospitals in Malaysia. So these are a few things. And we see a lot more increase in confidence in terms of the doctors who need to do a surgery, a junior doctors who want to learn. These are the kind of, medical learning that, can transform the whole experience. So again, a little bit of an explanation on what exactly the difference is between virtual reality, mixed reality, and augmented reality. So the solution that we're talking about enables the mixed reality environment. Basically, you can see the imaging, but you are still in your own environment. In a virtual reality, you get into a digital environment that actually shuts out the real world. But in mixed reality, you would actually see that whole imaging, but you are in a real world situation. You can also see the real world, you can still see, you can be in OT, or, you'd be able to feel like you're actually in the same room. And augmented reality enables them to actually, augment a certain image to a real life scenario. Yeah. So this is the difference between the whole real. And again, a little bit more detail on this particular solution, where the DICOM images, which are the X-rays and the CTs and angio, MRI scans, all of these can be transformed using the software application and then viewed in using the whole smart glasses concept. So this is a great use case for 5G because one, this whole imaging, and you know how heavy of a bandwidth this whole DICOM images could be in certain imagings, and to actually transform all of these in a 3D imaging and to be able to manipulate them, to be able to see them in 360 view is completely this experience is actually quite similar to actually playing a game actually. So that kind of experience in augmented reality would need a very good speed, would need a very good latency as well. So that's the kind of solutions that we're talking about in Malaysia. So I'm going to finish my slides with the vision of a world-class 5G smart hospital. So in terms of implementing in your hospitals in Brunei or whatnot, right? It's very important to actually identify what are the use cases that are going to give you the best medical services for the country, for the particular hospital as well. So we're talking about 5G connected ambulance, we're talking about smart bed use cases, we're talking about augmented medical trainings, and then what other applications that also could be use cases that can be very relevant to patient services. So in terms of congestions, the first point in terms of patient experience is that when you go in queue to get a number in the hospital and to register yourself. So if you could automate the whole process and also move on to the whole remote consultation, and patients also need very good when they are in the hospital, they need good 5G connectivity, or even 4G, or even Wi-Fi. I mean, these are the kind of services that you need to look into. And then also looking into separately on increasing the hospital management efficiency, more into drone medical supplies, unmanned vehicle. Thailand did this in their hospital. From one building to the other, they would just rely on an unmanned vehicle to actually just transport the whole medical files or medical supplies that needed to be transported. Basically, it makes sense when it's a less, to actually reduce your man hours looking into that. And also the whole e-pharmacy, embarking on the whole e-digital pharmacy initiatives as well. So in all, this whole thing needs to actually be in place in a hospital in a single use case manner. And then you could actually look into a bigger scale where you actually have a private network setup. That means a dedicated setup for the particular hospital. So this means your 5G connectivity is reliable, and it's just a very dedicated, secure network just for the hospital. You're not sharing it with the outer world. You can walk around with, but it's also a dedicated network, especially when you have more and more applications that are going to be utilizing 5G. And then the whole smart hospital campus as well. You are going to be seeing that the hospital is not going to be just connected devices, but all these connected devices need to be monitored. So the whole concept of bringing the monitoring center with 5G and cloud and AI, right? And also innovative applications incubator. Hospitals need to be innovative to actually be, enabling all of these startups in this industry. So this creates the whole concept of 5G smart hospital, and also brings the benchmark of a 5G hospital, and with the number of use cases, and also the whole national healthcare data platform needs to be in place for a country. And then it creates the whole nationwide access to the healthcare. Thank you so much. And I end my slide here.
All right, thank you so much for sharing your slides, Ms. Rajeshwari. I think it was important to address those pain points so we can be better prepared in the future. I'm looking forward to see how 5G evolves over the years, but I'll be hearing more from you later during the Q&A session. We'll be showing a video on Bejana, Productivity and Efficiency Joint Funding for Digital Adoption, which aims to encourage the adoption of digital solutions by MSMEs through financial funding to a portion of the solution's total cost.
Bejana scheme is a joint funding scheme and is open for businesses 100% local owned by Brunei residents and permanent residents. The business must be categorized under micro, small and medium enterprise. The business must be active and operational for at least 2 years. Eligible MSMEs who wish to follow the scheme will need to pay a minimum amount of 50% to a maximum of 50%, where the rest will be covered by AITI. The percentage depends on the annual turnover of the MSMEs. Just to highlight, the maximum subsidy provided by AITI will be 5,000, which will be made available for 1 year. To know more on this, you may visit AITI website.
Right, so thank you so much for your patience. Hope everyone had a good break. Now it is time for the question and answer session, and I will pass the floor to our moderator here, Florence, for her to manage the Q&A session.
Thank you, Hani. Thank you, and good morning, everyone, once again. Hi, Mr. G and Ms. Rajeshwari. Thank you for your excellent presentations. I think that is exactly why we are here today. And I completely agree that 5G is a buzzword that people are talking about, but not necessarily knowing what it is or how it's going to help, right? And I think it is very important as well, and it was very valuable to hear from Mr. G giving us the cold hard truth that a lot of things can be done with 4G. So why do we need 5G? So we do have a question in the chat, so perhaps we'll address that first. That is going to Ms. Rajeshwari with the question, how has Malaysia utilized the eSIM or embedded SIM with the 5G and IoT in Malaysia's healthcare?
Okay. Regarding the eSIM adoption in Malaysia, right? It's actually been quite, it's very dependent on the device as well. So a lot of the operators, the telco operators, have actually enabled eSIM for certain types of devices only today. So it's not widespread yet. But I think there's a lot more potential actually to be using eSIMs. And with 5G, definitely, yeah. G, do you want to add something on that? I think he's...
No, I think your answer is good enough.
Yeah, it's very dependent on the telco operators to actually, enable eSIMs for the particular devices. Even today, I think only certain types of iPhone and also certain types of Samsung phones that are only enabled with eSIMs. So we do not see yet a lot more IoT devices adopting eSIM at the moment, unfortunately, yeah.
Okay, thank you so much for that answer. Actually, since we don't have any other questions in the chat for now, I'd like to take this opportunity to urge our participants who are tuning in to drop your comments, whether it is a private one to me or to everyone. Please feel free to drop a question for our panelists today. So going back, perhaps I'll get the I'll start with my curiosity and my questions, right? So I think it is really glamorous to see what we should be anticipating for in the future in terms of healthcare. But I'd like to take one step back actually to kind of assess where we are currently and how 5G can help in that situation, if it can or otherwise, right? So as a patient for myself, like I would, we heard the pain points that both Mr. G and Ms. Rajeshwari has mentioned in the presentations, right? So in terms of excellent healthcare delivery, as a patient, a pain point for me would be the long waiting hours for me to see a doctor. And again, the additional hours that I need to account for waiting for my medications. So in this sense, I'm curious to know whether 5G can improve this, and if yes, how so, right? So we did hear from Mr. G earlier about perhaps there's not much change to waiting time, but in terms of patient experience, it can be improved. So I'd like to get both your perspectives, Mr. G and Ms. Rajeshwari, but perhaps we can start with Mr. G first.
Yeah, I'll start first. Okay, so you asked the question, how can your patient experience, your pain point be resolved with 5G, right? Okay, I think we covered many of that in my presentation and Raj's presentation, but I'm going to take one step back. I think we are looking at 5G in a typical traditional healthcare model. right? And I think that's wrong. What 5G brings to the table is a lot more than before. Let me put things in perspective. We know that there are many segments in healthcare, right? So one of the earliest and the most important segments is actually preventive healthcare. I'm sure you guys know, right? Healthcare model, hospitals, clinics, institutions are primarily built on the fact that they provide not healthcare, but sick care. That means treatment is provided once a person is sick, right? Only then a patient walks into a hospital or a clinic and so on, right? If you look at preventive healthcare, guess what, guys? Try to think what are the inventions so far in the world which has taken place in the world of preventive healthcare. Can you think of anything? I'll give you an example. Vaccine is one of them. Okay, so vaccination is one of them. Can you think of anything else? The answer is there are none, other than the fact that the doctors give you advice, exercise, eat proper diet, wash your hands. They are almost non-existent, right? This is where 5G is a game changer. That means to say, when 5G is deployed and 5G healthcare is deployed in the right way, you as a patient no longer need to seek healthcare only when you're sick, actually. Or only when you're not well. You will be monitored and your healthcare will be far more in a better state, okay, as compared to before. Hence, your patient's experience is far more better. Okay, now this is a broad perspective, right? And of course, I did mention about hospital, whereby the delivery of services at your home becomes far more easier and so on, right? I think other than that, then there are smaller use cases which me and Rajeshwari presented just now. There's remote monitoring available. There's lesser waiting time because you get to have more virtual consultation. And even when you arrive at the hospital, you have a number of other applications which enables you to wait lesser, right? Anyway, Rajeshwari, you can go ahead now.
Yeah, I mean, I think you covered most of it, but I think actually, Florence, what's very important is actually to understand why the long waiting hours in the hospitals are happening today. Why? In terms of why is it happening? Is it the congestion? A lot more patients are in the same hospital. Is that, the doctor to patient ratio is low, or the doctors are taking their time to actually see the patients? And then, what is the actual cost behind that, right? So if you look in Malaysia, the reason is actually, one is actually to do the manual registration in the public sector, of course. The manual registration takes a long process. The nurses that are sitting in front of there, they have to actually manually do the registration. It takes a lot more time. So that's why I think, what we started doing is that whole implementing the smart kiosks where they go in and the patients can actually do QR codes and scan them and all of that. So these smart kiosks, what we also did is that it will also enable the notification right to you. Like, okay, you have 1 hour more to go for your visit. This is your number, and it keeps notifying you. So you do not have to wait there specifically. You could actually walk around or, disperse the crowd and not be so congested. And this monitoring of this whole time as well, it actually helps, doctors to understand that, hey, I've got a long queue waiting, and also try to, manage the workload. I mean, if there's more patients today, then you need to have more doctors that are going to be looking into that, right? So these are a few small initiatives that can be done in order to actually address that whole issue of congestion in the hospital, the long waiting hours and all of that. But what is other, I think what is the other key factor that's more important in the hospital as well is that, to understand the, the need to be there as well. If there are certain criteria where they can actually be monitored from home, then they should be monitored from home. That whole regulation, the policy needs to be in place and adopted by the hospitals in the first place. Then that enables that, lessens the congestion in the hospital. I think that's two ways that we are doing it today in Malaysia, trying to reduce the congestions as well. Yeah.
Thank you for that. I do have a follow-up question actually, but let's, before we go into that, let's look at the questions that we have in the chat box. Although it's, I assume that these questions will be addressed to both Mr. Chi and Ms. Rajeshwari, wanting to hear both of your thoughts on what would be the biggest hurdle to adopt 5G in healthcare in the current climate. Yeah.
Okay, I already answered a bit, short answer in the chat actually. Now, biggest hurdle will be process and change management. See, most of the time we think that to adopt technology, you need to invest in infrastructure, hire more people and so on. But there's only three parts actually: products, process, and people. All right. Now, the toughest part is process, to change the way we work, right? Humans are creatures of habit. We are very habitual in what we do, be it at home, at work, and so on. So this is the hardest part, right?
Product, process, and people. That is, I did sort of expect that from a group CIO. What about Ms. Rajeshwari? What is your thought on that?
All right, I think, in terms of adoption for 5G for the hospitals, the very first biggest hurdle that has to actually happen is the technology acceptance. Such technologies, like for example, augmented reality, are the doctors willing to use it? We've not tested it out. We don't know yet. They've not experienced it yet. So all of these technology acceptance first needs to happen. In terms of, even I think the earlier speaker shared on mental health, how augmented reality, virtual reality can help. How many patients have gone into this? These are not tested yet. So the technology acceptance need to happen first across the whole, across the hospital, across the patients. A small scale adoption has to happen, and then when the acceptance happens, then you can actually make a bigger adoption in terms of 5G. But when it comes to 5G as a connectivity perspective, it is not a cheap investment. That's the reality of it. It's not a cheap investment. There is a lot of investment that needs to be done, and especially, like I would say, the public infrastructure cost has already been taken care of by the telco providers, for example, right? Even if you do it in Brunei, it must be the telco operators investing and building the coverage for the country. But for the hospitals, now, there's always been investment for you to come up with an in-building solution. And even in 4G, you did do that. That had to happen. There was an investment for in terms of in-building solutions, and it's not the whole cost factor plays a big role. And then that's why, based on the use cases that has been adopted, as much as possible, I would actually say that, if you could rely on the outdoor coverage, great. But in most cases, campuses are big, and you might have certain rooms, especially like, radiology unit and operation theaters that has a lot more thick walls and thick doors. It's impossible for 5G outdoor coverage to actually penetrate into a big, huge buildings. So then you need to invest in a whole in-building solutions. And then the other part that I talked about, if you want to use these solutions, 5G solutions, for example, like augmented reality, and you want to use for robotics and whatnot, right? Even patient monitoring, you want to have a stable, reliable, dedicated, and secure. 4 new words that I said. You have to have a secure network. The whole slicing of the architecture itself it's an investment. So that's the kind of hurdles that we see, that investment cost, the infrastructure cost, the technology acceptance mainly. But the first for me would obviously be the technology acceptance, then comes the rest. And the last point was, of course, regulations. If you see a lot more devices are coming up, but are these all medically certified in this? And every country has their own policies and regulations in terms of medical grade devices. So they can be Singapore FDA, Singapore certified, they can be US certified, but when it comes to even Malaysia adoption, we have to go through a whole process again. So that whole adoption of devices, certification programs, policy, regulation has also to be aligned in order for it to be adopted. So it's a big hurdle, to be honest. So yeah.
Thank you. I love that. I think I completely agree when you mentioned technology acceptance as well, because that is my question to that is that, do you think that even with the current 4G and telemedicine, it is considered widely adopted at this point in time? On both the patients and then also the healthcare providers end.
In terms of telemedicine, I don't think so.
No.
The percentage.
So we are actually going to robotics and a lot of more sophisticated.
In fact, I think the neighboring countries that have actually established the right telemedicine act is only, as far as I know, Singapore has done it. Across Asia Pacific, of course. Southeast Asia itself. In Malaysia, we're still yet yet to, come up with our whole Digital Healthcare Act that enables telemedicine formally. So, maybe G want to talk about it? He knows more.
Right. So if you ask about adoption, even 4G, right? Now, here's the thing, guys. Like what I mentioned before, it's not the technology. See, the infrastructure is there. 4G is pretty matured, right? But guess what? In my opinion, we have not even started utilizing or enhancing what 4G has to offer. I give an example. This is 2023. About 11 years ago, there was, I can call it an experiment funded by MCMC. MCMC is an authority in Malaysia as well, right? Something like DNB. So they gave a hospital, a private hospital, all the gadgets. They funded the gadgets, basically to monitor patients after surgery, after procedure and everything. And an excellent use case and test case, experiment done. There was a very good outcome. The papers were written, presented to the Minister of Health in Malaysia, right? What should have happened? Adoption should have happened. Replication of the success story should have happened. Guess what? It didn't happen, right? Why it didn't happen? That's $1 million question. But I would attribute it to mainly because it introduced changes to the way things work. So it's not just a technology piece. So again, going back to my product process people, product is easy, you can buy, people you can hire, but process, guys, process requires change management, right? So it's not easy. So again, even 4G has not been fully adopted yet.
Oh, thank you for that. Thank you. I think definitely we do have to look at 4G first before even talking about 5G, right? But I think because of the hype and all the interest surrounding 5G, there are a lot of curiosity as well. So our next question from the chat is on smartwatches being a big trend nowadays. Most of us do have smartwatches, even though we cannot discount those who do not, right? But would 5G be able to integrate with these devices to help monitor and diagnose chronic diseases such as diabetes, heart diseases? This is a question from the chat.
Short answer is yes, obviously. I mean, your watch is not going to tell you, yes, you have diabetic or yes, you have blood pressure, obviously. But what it can do is it can do excellent data collection. Data collection when you're running, working out, sleeping, everything. And this data can be fed into the AI in the cloud. And then like what Rajeshwari mentioned, you got the A, B, C, D, E. With the technology on the 5G, on the cloud, it can diagnose, it can tell you, your doctors can get access to the data. And yes, that's definitely 5G is an enabler for those kind of diseases.
The question regarding the smartwatches, a big trend today. It's very important to understand that in terms for hospital usage, in order for them to actually monitor it, right? So your smartwatches needs to be medical grade. So that's very important. So today, a lot of smartwatches that are coming up, they're not medical grade. So why we call it medical grade is because they has to keep producing the correct results again at any time. So if it's monitoring, and in a lot of cases as well, if you take a look at globally, all of these big brands like Apple, Amazon, even Facebook, Meta, and all of them, they all are venturing into coming up with the devices. There are a lot of stories, even in my personal friends, that have actually helped save their lives through an Apple Watch. So this has happened. If you could see, an Apple Watch will tell you the elevated heart rates that and you go and check it out, and then that notification is very, very important. But that is your own monitoring. You are monitoring your own health, which is great. But now for these 5G enabled integration that needs to happen, in most cases, 5G integration only happens when value chain that I spoke about. The 5G integration is not necessary to be integrated into your smartwatch, but the data that's pushing it out. So in most cases, devices actually are Bluetooth enabled. Smartwatches can be Bluetooth enabled as well, because you want long consumption of your battery. I mean, you want to have a long battery saving and all that. That is why we do not adopt 5G into the small devices. They are always Bluetooth enabled or Wi-Fi enabled because of that particular reason. You need power saving. You don't want to keep charging them like your phone. You have to charge them every day. But I do see that happening in the future. But why I call this is that a lot of these watches are actually incorporating sensor-based devices. We call them sensor-based. How are you monitoring your heart rates? It's all sensor-based, right? So these devices could be actually they are much functional, much even today in a Bluetooth world, they would transfer that to your phone. Your phone now becomes the gateway to the 5G world. That the 5G integration happens to your phone. 5G integration can happen today. A lot of these medical devices, for example, like a glucometer and all of that, right? These are medical, SpO2 devices and all that, medical grade devices that are used for monitoring. These connect back to a gateway that has 5G. That is how the 5G integration happens. And then it connects back to the hospital, where the hospital can monitor you through a 5G monitoring system. So that's how the whole integration happens. So I hope that is very clear on how the adoption happens today. So it is wrong for you to expect that, hey, my smartwatch needs to have 5G. Why there's no 5G in my smartwatch? Not necessarily. Yeah, because one, it has to be medical grade. We need medical grade devices to be used for medical usage. We are not going to, allow every other brand to actually say that, it's going to be helping you to monitor and all that. But it's good for your own events. I would still ask you to use a good watch, for your own awareness. That's definite. But of course, for the use of a hospital, they need medical grade devices. I hope that answers the question. Yeah.
Yes, actually, touching on adoption, we have a lot of questions in the chat that is even privately messaged to me about adoption, actually. So they are interested because understanding that you come from the, and you have expertise in the Malaysian healthcare landscape, right? So, so in Malaysia, or even if you can provide insights in other places as well, how would the telcos support the government or private sectors in the adoption of 5G in healthcare? Or what are your thoughts on that?
Okay, what was the question again? What in terms of adoption?
Yes, in terms of the support that the telcos are providing to the industry, whether it's government or private sectors.
All right, in terms of adoption. Okay, so in terms of adoption, what we are trying to do is that, we I think I presented a slide, if you can remember, it recalls the whole strategy that we plan to do is that we work in a short-term strategy. We work with all of these solution providers. That means all of these solutions that work on patient monitoring, remote consultation, connected ambulance. We work together with them. We, in fact, allow them to be doing their proof of concepts, test them out, deploy them in the hospitals in a small scale so that the technology acceptance happens, right? So once that has happened, so that's the kind of, in order to accelerate the adoption, that they need to prove it, they need a hospital to prove it. All of these solutions, they are innovative. And in fact, even monitoring itself, there's so many devices that are used today for monitoring. And all of these devices still need to be tested out with the small scale patients and small scale hospitals. So that is what we are, how we are doing it today. We are going out and making sure that the hospital allows and adopts them in a small scale. And once the technology adoption comes in, and how are we doing it in 5G? Let me just explain that as well. So in order, like I said, it's a huge investment if it's dependent on an indoor capability. Today, from DNB, we do check the locations in some of when we actually launch as part of our infrastructure build itself, we've also deployed in-building solutions for 16 public hospitals. So today, 16 hospitals in Malaysia has been already planned to actually have an in-building solution as well. So it is actually part of our infrastructure build. So we've already converted them to have 5G in the hospital for the public sector. In the private sector, what we do is that based on their location, we actually rely on the outdoor 5G connectivity. So there's a concept called the FWA setup, fixed wireless access setup, which actually uses a CPE as a device, right? This is a small router-based devices that can be put, if your outdoor coverage is good enough in that whole location, then you could use it in CPE in the hospital environment. These are for small scale use case. Just don't quote me wrong. These are not going to be widely adopted. CPEs will only cater and help you in a certain location. It needs to be tested definitely. And if let's say in that particular room, then you could get a 5G Wi-Fi signal. So that's the whole concept of it, right? So that's how we are trying to adopt it. We create that whole space for the solution providers to actually test their solution. And we try to do it in small scale of 5G implementation as well. And also there's also a concept where 5G in a box concept where we actually allow 5G private network, bring 5G private network solution for it to be tested in a hospital environment. So these are a few things that we, in terms of a proof of concept, we are already doing it today for hospitals in Malaysia.
I think that's great. I am so curious about what you mentioned about doing it small scale first, right? So just out of curiosity, so when you actually first go to a hospital or like you approach the healthcare providers with these innovations, what were the kind of like thought process or the journey? Was it a little bit of skepticism at the beginning, or were they very excited about it since the get-go?
Actually, it has been a great journey, and it's been very, very well accepted. With this, I mean, for in a lot of scenarios, most of the hospital, even though we think they might already have 4G, they do not really have a very good connectivity because of the reason that hospitals today, especially the public sector, the hospitals could have been built years ago. And for them to rely on for them to go back and fix wired connection would be a more cost than to go for a wireless solution like 5G. So then it becomes a more adopted, you rather adopt the newer technology rather than going back and putting up, dig the hole and put up a wired connection for a particular building. So that particular point, right? So they're already suffering. In most cases, even in Malaysia, they do have, I can't get, I can't get signal I can't get coverage inside the hospital. Like I said, it's a huge building. Not every building is covered today, especially with 4G or 5G. So because of that particular reason, they're very, very accepted in terms of, these are the kind of things, these are the kind of new technologies that can be brought into my hospital. They are very willing to try it out, actually. But it's very, very important that a lot of people, like how G said, the change management or the champion to actually lead this within the healthcare sector, within the hospital needs to actually happen. A lot of people take that approach that my daily life is actually very, very congested because they are looking at so many patients on a daily basis. So they might not have the time to explore or have the hand-holding process. Like for example, I'll tell you that even the adoption of augmented reality, for them to learn how to use the smart glasses, how that click and all of that, it is taking us the time for us to teach the doctors, hey, this technology will allow you to see X-rays no more in black and white. You can see it in color now. You can manipulate the whole image. So how do you teach them? The whole training needs to happen, the whole acceptance of the technology, the change. That's how we are, doing. That's why I think you still need to do it in small scale and then prove the case study that it works and then bring it to the bigger scale. Yeah, right. Big investment will be, it's you can't do an outright big investment. That's what I feel.
Step by step, right?
Yeah.
I think there's one very, very important question that is also something that is close to my heart as well, which is asking about the security, right? So here, our audience is asking, what is the level of security risk when 5G adoption is successful? And will our current security in place be able to offer the sufficient protection? Or what do you think? Is there an incremental value to 5G compared to 4G when we upgrade in terms of security?
Okay, so this one is very, there's two parts to this question, right? When the security risk in terms of adoption in a hospital, for example, the remote patient monitoring now, right? Let's just take a simple example. In a remote patient monitoring, you are a lot more devices which are connected, and you're connecting to a 5G network. It's your patient history records, your health records, which are very sensitive data, right? Will the current security in place? Okay, so now there's two parts to this. One, the device platform. the IoT platform layer that is connecting all of these devices, they have to be in a secure platform. And then the stack next to it is the 5G network security. One thing about Malaysia is that because we are a single provider of infrastructure for 5G, one of the key importance that we can provide is that we have created a very good secured system to monitor the whole 5G infrastructure. Our network and security systems is actually very, very, we have given a lot more attention to come up with a whole protection and security in order to ensure that there is no hack between in our 5G infrastructure at the infrastructure layer. But at the layer of the IoT platform, it is very, very highly dependent on who's providing the solution. It's dependent on who's providing the solution, what kind of cloud services are you using. It's also quite dependent on that, right? So that then will today current security be that is already sufficient enough for the protection? Depending on the who is providing the solution, you need to have a more secure layer that needs to come up, and especially adopting the healthcare benchmark secured, like using HL7 as a policy and whatnot. Then you could actually, as long as you reach that standard that's relevant to healthcare adoption. So that then with that, then you can ensure secure adoption in terms of, and with less security risk, definitely. Yeah.
I thank you for that. We do have so many more questions actually being posted, but I did get a note from our friends from the management team that we will end the session at 10:45. Okay. So perhaps we'll see, maybe we can take maybe one or two more questions in order. If you, let's look at one that mentioned this. So he said, something that is not related to 5G, but coming into 2023, AI has been the headlines everywhere, especially with the open beta of ChatGPT. Out of curiosity, is this of concern or opportunities for the healthcare sector? So I think previously we did talk about how 5G is related to like keywords like, high speed, high bandwidth, and low latency. And I think AI is related to that in a sense or two. So I would like to see what you think about that.
All right. So I think, artificial intelligence is very, very important. It's not a concern, definitely. It's definitely an opportunity, but and in terms of ways of working in the healthcare sector, artificial intelligence can be implemented in every solution. So even in a patient monitoring solution, you could see that instead of a human actually monitoring, artificial intelligence, machine learning comes into place, where that whole data that is being transmitted, you need artificial intelligence to actually monitor all of this, come up with a threshold and make sure that, it understands the pattern and all of that. So there's a lot of implementation of artificial intelligence, AI in healthcare sector. What is the concern is that, again, is the adoption. There are still very, very, the slow adoption rate in terms of understanding and saying that, hey, there is an artificial intelligence that has to, that is telling me that this is this pattern, then these are the symptoms of a patient. Is this, and it has to complement with the doctor's diagnostics. The doctor's diagnostics now can actually say that, okay, I've checked this AI patterns and I feel like, the symptoms are, the AI should just complement it. It's not going to replace the doctor. That's not going to happen. But that concern is still there, that it's going to replace the doctors. No, it's not, never should replace the doctors. It is always should be a complementary technology that is going to help the healthcare sector in order to, one, make it more advanced. Second, for the doctors as well, for the workload, for the resources, for them to actually do. I'm giving you a very high level answer because it's a very depth conversation. Because if I go into the depth of how AI actually applies when it comes to imaging scans, how AI detects the tumor first, and then the doctor diagnosis based on the AI's input as well. So AI becomes a first level insight only. And then the doctors need to look into it. So the first level of insight is really an opportunity to healthcare, definitely. Yeah. Yeah, I mean, I think that's the, answer to that question. Yeah.
Yeah, I think that's very insightful. I think we see a lot of thumbs up in the chat as well for that question on AI. I think everyone's talking about it nowadays, right? So I think because we only have 1 minute left on the clock, we appreciate and we have heard so much from you today. But again, like if say somebody perhaps just joined us now, what would be the key messages or key takeaways that you would like this everyone here to get from the session?
Right. I think, for one of the key takeaways that I want to give to Brunei is that based on your landscape, a smaller country, smaller, population and whatnot, it would be great. And if you could be the most transformational country with a 5G adoption, you could create a benchmark hospital. You have a lot more, you could a lot more faster move. I would actually benchmark you guys with Singapore. So, how Singapore is doing it today, they've already created a national healthcare debt platform in order to actually use all of these solutions in that platform, dedicated platform. So these are the kind of things that you could do already, start doing. And I think the last question, I really like it. Who should be the 5G champion be? It should be the Brunei's, the initiative should come from the government, the push should come from the government, create the infrastructure for the country, build a network infrastructure for the country, and focus on creating a 5G smart hospital. It's very, very important. And please remember the last slide that I presented. The vision of a smart hospital is not one use case. You're not going to come up and say that, I've created a connected hospital with one use case. It's going to be multiple adoption of connected use cases. And then you create the whole benchmark hospital. Thank you so much.
Thank you, Ms. Rajeshwari, for your time. And with that, I would like to pass the floor to Hani.
All right, thank you so much. Thank you for that informative session. I would like to give my appreciation to Mr. G, although he's had to urgently leave, and Ms. Rajeshwari for shedding light on the capabilities of 5G beyond Brunei. It was perfectly well said. And thank you so much, Florence, for moderating and making it as seamless as possible. I do hope that the information shared today is able to help progress Brunei's healthcare industry and everyone leaves feeling empowered. So thank you again to AITI for this opportunity to expand our knowledge on 5G for the healthcare industry. With that, Assalamualaikum warahmatullahi wabarakatuh and have a great day.